No, but and you should have gotten a reminder. Did you? You didn't sign up live? I can give you. I mean, if you didn't sign up for the webinar, I will send you the link to send to her. How's that? Just go ahead. If you type in the email you want there, it'll send the webinar link to them. Yeah, I think we can see if anybody's, let's see who's, nobody on yet. Yeah, that's okay. Do you see who, can you see who it is? If it's my mom, I need to say hi. Remember when you were here last time, my mom called. But she's maybe my only thing. she's not signing on today. She won't. Oh, 4 people now. Okay, hi everybody. We're just getting ready, so hang in there, and we haven't started yet, but thank you. I see some of you on here. If you're having trouble hearing anything, please send a chat at the bottom of your screen, and we'll make sure we adjust. Okay. I'm gonna set this to. All right. Okay, you're doing it on your phone. Okay. So, but you do have. Oh, but it doesn't show who. Okay, that's fine. That's so weird. Okay. I'm gonna turn on this light back here. You're okay. Okay. Yeah. What's that? Yeah, I know. I'm gonna say hi to everybody once we start. Hi, everybody. We're gonna start soon. Okay, we got 9. We'll wait till 6:30. Mic's on. Screen share. Turn screen. Screen share's on, so they're seeing that. Oh, great. That's what they're saying. Okay, thank you. I just don't know. Can you send a chat out to everyone just to ask them if they can hear the audio? It's cold this morning, wasn't it? Yakking so much. Okay, sorry. So there should be sound now. Can everybody hear me now? Okay, hi everybody. We're about to start. If you can hear me, if you can't hear me, make sure you send a little chat signal and we'll adjust. But everybody can hear? Okay, good. All right, I'm going to switch over. I'm going to turn this off. If I can get there. Okay, that off, webcam off. Let's go over to here. Hi, Madeline. Have a seat. We're just getting started. So welcome, everybody. Thank you. This is our nice little intimate group. Welcome to Healing with Stem Cells. And we've got a bunch of people online that are participating, and then this will be available afterwards as a recording. So if you miss something or you want to catch it, we'll move there. So let's get started. You see up here, Neil Reardon is the author of a great book, if you want to get a really good, interesting introduction to stem cells, called Stem Cell Therapy, A Rising Tide. And what he teaches is that most chronic diseases are due to a lack of or dysfunction of mesenchymal and other stem cells. So we're going to explain more about the different kinds of stem cells in a little bit. But first, I just want to share with you something kind of very interesting. If I can get my thing to move here. No, it's not moving. Okay, hang on 1 second. Do it this way. There we go. So one of the very first things that I studied when I got into medicine was, it was fascinating to me because I was into mind-body medicine. And I realized that, I learned this actually from Norman Cousins, who wrote a book called Anatomy of an Illness, that in medical text, you read all about the digestive system, the nervous system, the circulatory system, but there's never a chapter on the healing system. And in fact, it is this healing system inside of us that orchestrates this unbelievable symphony of immune function and nervous function and repair function that really heals us. You can see nobody ever talks about the healing system. Well, after studying stem cells for this long, I really believe that stem cells are the essence of that healing system. Now that we've kind of uncovered what they are, how to retrieve them, how to multiply them, and how to utilize them, that is really the essence of our healing system. So I want you to think of stem cell therapy. It's also called regenerative medicine. So what we're doing is and I'll explain how this works in a minute, but in chronic illness, what we found is that either we don't have enough stem cells, or the stem cells that we have don't function as well. So it'll come as no surprise to any of us here that as we age, lots of things don't work as well as they used to when we were younger. And we can't do certain things with the sort of quantity or ability that we could before. So it's not surprising, right, that our stem cells to some degree decline in number as we age, and they decline in function. But we now think that this lack of enough stem cells and the lack of function in these stem cells is probably at the heart of most chronic illness. So what stem cell therapy is, it's really a transplant. Everybody knows about bone marrow transplants or a corneal transplant or a liver transplant. What we're essentially doing here is, you can see on the right here, this transplant to remove from one place, or here in surgery, to transfer from one part of the body to another, or from one person to another. So that's true in stem cells. We can retrieve stem cells from embryos. We can retrieve stem cells from newborn placentas and amniotic fluid and umbilical cords, from healthy deliveries. We can retrieve stem cells from adults. We get it from usually the bone marrow or the fat. And I'll show you how we do a little mini liposuction here to retrieve fat to get stem cells. But the point is, we're taking these cells, then we multiply them, we concentrate them, we multiply them in number, and then we just transplant them. We re-inject them into the body in whatever area is damaged. And I'll show you some pictures very soon of like diabetics that had ulcers that wouldn't heal. And these diabetics were set for amputation because if the ulcer doesn't heal, the infection goes to the bone. It's all incredibly, complicated, and it often leads to amputation. So in 75% of patients in the series I'll show you, just by injecting stem cells into and around the ulcer in the foot or the lower extremity, it created enough new blood vessel formation that the healing system cells got to that area and were able to repair it 75% of the time, which is unbelievable. You think 3 out of 4 people that are slated for amputation don't need to get it. So it's a really remarkable thing. So let's move on to the next slide. So mesenchymal stem cells are, they work everywhere in the body. Let me kind of explain the 2 different types of stem cells. The 2 main types, if you look in the bone marrow, there are hematopoietic stem cells, and hemato stands for like blood, just like a hematocrit in a blood test, right? So the hematopoietic stem cells are responsible for bone marrow health. That's what creates the white cells, the red cells, the platelets, all the cellular function that a bone marrow puts out, okay? Inside the bone marrow as well are MSCs. We just abbreviated MSCs, mesenchymal stem cells. These mesenchymal stem cells they don't create blood products, but they are the beginning of a lineage that in a laboratory through tissue engineering, you can take an MSC and turn it into a bone cell, a nerve cell, a cartilage cell. Now, there are different types of MSCs, but the point is it won't form every kind of organ in the body, but I'm going to explain how that all works. So somewhere during the process, after we're born, we have a ton of these MSCs in our bone marrow. But very shortly, even within a couple of years, that number goes down dramatically. And where are those MSCs going? They migrate from the bone marrow out to the body, and they live around blood vessels. And these MSCs are in every part of our body. In fact, if you didn't have healthy, good stem cells, we wouldn't live more than an hour. That's the prediction. If you don't have stem cells, so next to oxygen, that's pretty much one of the most vital things, right? Oxygen is minutes, and stem cells is hours. Water, we can go a long time. Food, we can go a whole long time, right? So these are pretty high up in the hierarchy of important. But MSCs in the body, when we do liposuction, I'll explain more, or bone marrow, we isolate the MSCs, not the hematopoietic. For a bone marrow transplant, they use the hematopoietic stem cells. But for most of the conditions like autoimmune conditions, lupus, rheumatoid arthritis, even the diabetic ulcers, the things that we use are MSCs. And the guy who named these mesenchymal stem cells was a Dr. Arnold Kaplan. And he realized early on, actually he realized much later after he did his research, that these cells in the human body, when we inject them into a vein or into a body part, they don't turn into other cells. Everybody thinks of stem cells, stem cells, that can become anything. That's true of an embryonic stem cell. The problem with putting embryonic stem cells is there's a lot of downside too. You can inject embryonic stem cells in a part of the body, think you're going to grow, one or regenerate a liver, and instead they decide to grow into a bone or other tissue or an eyeball. I mean, to be really weird, but these things happen, right? So we don't play around with embryonic stem cells. The reason that we used embryonic stem cells in the early days was to understand the tissue engineering. Because when what's called a pluripotent embryonic stem cell. It means it can turn into anything, a liver, a kidney, a brain cell, everything. Then we can learn how to develop these tissue lineages, and that's called tissue engineering. And then from those, we can hopefully one day make a kidney out of stem cells and put it back in you. We don't have to wait for a donor kidney one day, right? So those are the dreams of that kind of tissue engineering. But what we're using in practice here today now to help joint pain and autoimmunity and those sorts of things are MSCs. And the way that they work is they signal. They send signals to existing stem cells in your body to encourage them to grow, to multiply, to regenerate. I'll show you how that works. They're like a little some of you remember MASH, right? I asked Shannon, she doesn't remember MASH, but those of us who are old enough love MASH, right? Mobile, Army, whatever, surgical hospital. MSCs are really like a little mobile hospital. When we inject MSCs or mesenchymal stem cells into the vein, they circulate throughout the body, and they do very different things depending on where they land, because not only do they secrete growth hormones and what we call cytokines and proteins that stimulate regeneration, they also reduce inflammation throughout the body, but they also sense the signals coming from the local area. So it's not like sending in just, when you give a medicine, like amoxicillin for an infection, it goes everywhere. It kills the bad strep, but it also kills the good microbiome, right? It kills the healthy bacteria in your gut. It's kind of a dumb bomb, if you will. These things are smart. They go, and depending on where they end up, like let's go to that diabetic ulcer we talked about. When you put it in there, it senses that local environment. And in some of those areas, they may need new blood vessels, and it'll stimulate the proteins that stimulate new blood vessel growth. But in other areas, maybe there's a little infection, and it needs to actually make more inflammatory molecules to get rid of the infection. So this is like having, BJ Honeycutt and all these smart surgeons around in your body now, kind of supervising the local repair effort and figuring out what do we need to do to fix this thing. This is how it all works. This is the fundamental, if you think of the cell as kind of like the fundamental unit of biology, and then, a bunch of cells or a tissue, and the same kind of cell goes into an organ, and the organs work together. This universal stem cell niche is where it really starts to make sense. So what you see here on the right is, I'm going to see if I can, it's not showing up here, but I'm going to do it for the sake of the people online. This little cell, and see if I can do that right here, is called an MSC. That is a pericyte. This is a blood vessel here. You see the little platelets coming through here. That's a blood vessel. And right on the outside of the blood vessel is this MSC, mesenchymal stem cell. Now, MSCs in the body live on the blood vessels in the capillary beds. When there's damage to a tissue and that blood vessel breaks, think of a cut, those MSCs break off the capillary and it becomes activated. And then once it's activated, it will stimulate this tissue-specific stem cell right here. If you can see this, these are tissue-specific stem cells. What does that mean? It means in your liver, you have liver stem cells that produce only liver cells. In your kidney cells. In your brain, neurons and brain cells. In your gut epithelial and gut lining cells, right? So when we put an MSC, if it goes to the brain, it will stimulate the growth of a new brain cell. And it does that this MSC itself doesn't become a brain cell. Even though you can make these stem cells do weird things in the laboratory through tissue engineering, in clinical practice, that's not how it happens. They will stimulate the tissue-specific stem cells. So if you have fatty liver disease, these stem cells will go into that area because they home in just naturally to areas of inflammation and damage, and they try and initiate repair. And they do really amazing things to get those tissue-specific stem cells to wake up. So why are those tissue stem cells asleep? Well, it goes back to what we talked about. Either there's such a decrease in number or toxins that we eat. So that's when we did all our functional medicine training here, and we talked about detoxification and toxins in the environment and heavy metals. A lot of these things destroy stem cells. They destroy the tissue-specific stem cells. And then as we age, the blood supply isn't as good. We accumulate chronic stress and damage and tightness and muscle, achy, and so areas don't grow as well. This is why these things are so amazing. And we'll talk about joints for a second. The first place that we really got started with stem cells was in joints. And we used to think, well, when you put these MSCs into a bad knee, that's bone on bone, for instance, do they turn into new bone or generate new cartilage? Well, we thought maybe some do engraft, and we still don't know. Some might do that. But overwhelmingly, what they do is they get in that area, they sense that there's wear and tear, they sense that there's damage, and they send out these, what's called a secretome. They're secretions, the growth factors. We call them trophic factors. We call them cytokines. They send out all these messenger molecules to stimulate your own tissue-specific cartilage cells to wake up and regrow. And that's why you see basically you see a joint that looked like it was bone on bone now has a space in it where there's healthy new cartilage. Now, it doesn't always grow back completely. This is a process, and depending on how bad the damage is, you can get more or less, improvement, but it all works by this. The whole idea is anything that increases blood flow. This is why exercise is so good for stem cells. When you exercise regularly, there's angiogenic factors that create new blood vessels. The more blood vessels you have, the more of these pericyte MSCs here can live on the blood vessel. And then they can help to stimulate the tissue-specific stem cell, wherever it is, to regrow. Okay, let's go to this next one. So I already kind of went through this, but the MSCs live as pericytes, which just means they just kind of hang out in an inactive state. They kind of loiter, if you will, on the capillary bed, right? And then when they see some action, hey, something's going on, they fall off, and then they undergo this sort of sequence of changes here where the pericyte becomes an active MSC. And that active MSC initiates all this regenerative activity by stimulating tissue-specific stem cells and also by creating new blood vessels. They put out something called VEGF, vascular endothelial growth factor, which causes new blood vessels to bring new healing elements into the blood. And they also have an anti-inflammatory effect. I think that's on this next slide. So this kind of explains it better. If you look here at this medicinal MSC, it has all these trophic factors, anti-scarring. This is a very fascinating one. When we first started doing IV injections, not here, but in Panama, Dr. Reardon, for autoimmune disease, they find out that patients that had acne scars from teenage years, the scarring went away. These stem cells got into the bloodstream, found the inflammation, because scar tissue is living tissue as well. And it just replenishes scar tissue. So when healthy stem cells were around, then they could replace that scar tissue, and old scars often go away. So I think we're going to see this as a big treatment, plastic surgery-wise too, in the future. Is you can revise scars or keloid formers or whatever. But you can see here we've got sort of two phases of what these mesenchymal stem cells do. One is they modulate the immune system, and this is how they work in autoimmunity. These Treg cells are what's off in almost every autoimmune condition, from lupus to Parkinson's to MS. The T regulatory cells help balance out the immune system. If there aren't enough Treg cells, then the immune system attacks your own body. That's what autoimmunity is. And you can get joint pains and rheumatoid arthritis. You can get lesions on the spine or the brain in multiple sclerosis. Wherever the autoimmune process hits, it damages those tissues. Psoriasis in the skin. So the beauty of using MSCs is that you get all this immunomodulatory effect right here that, oh, sorry, I didn't want to leave that slide, that actually we've seen cases where one or two injections, depending on the number of cells, and we have a limit in what we can do here versus in outside the country because of regulatory issues. But if the numbers are right, we've had people with 1, 2, maybe only 3 injections of stem cells that literally don't need their rheumatoid arthritis drugs anymore. They can stop them. So you can see some of the difficulty in advancing, like any new therapy. You're up against a system that is entrenched in wonderful things, but there's a lot of money, there's a lot of jobs, there's a lot of everything at stake. Now, will these things turn over? And eventually, yes, it will. It's like you can't find a carburetor anymore, right? There's something on the car. You don't play a record anymore, although they're coming back, vinyl's back, right? But the point is, we all get used to the new things and it'll move through. But right now, you can imagine, you've got a drug like Enbrel or Humira that runs 4, 5, 6,000 a month for a lifetime for patients. Now, insurance picks up a lot of that tab, obviously. There's still a big out-of-pocket expense. And you say for, even take the worst case scenario, take the highest expense on stem cells at like 20 grand an injection. Well, if it's 5 a month for Humira, in 1 year you spend $60,000. If it's 20, 25,000 and you can do 2 or 3 injections and you don't need to take it again for maybe 5 years or possibly a lifetime, you can see that's not going to go well if you make the drug that they want to sell, right? So this is why, one of the big reasons. And then take surgery for joints. I mean, that's a giant industry, right? The surgical industry is big. You've got the hospital making money. You've got the surgeon making money. You've got the anesthesiologist. You've got all the other personnel, the surgery centers. If I can put an injection in your knee joint that you told you needed a total knee operation for, and 60 to 70% of the time, you get a result that you don't need surgery for, and that injection may last anywhere from, at the lowest, 8 months or a year, but often 5, 10 years before you need another injection. Now, a certain number are going to need surgery, and God bless the surgeons, and nobody's saying anything bad about the system. It's just we're at a sea change in medicine. This is going to revolutionize how we treat chronic illness and the illnesses of aging and frailty, right? It has to. So let's move on, and then so again, as we said, they're essentially a cellular transplant. I like the Scientific American quote at the bottom. It's a good way to think of it. Stem cells are a biological repair system. They're just a mobile. We put them in the vein, we put them in the joint, just let them do their thing, and they do amazing things. Every time, no. But is there a downside to adult MSCs? No. Money is the only downside. You may be in the 25 to 30% of people or 40% of people that don't get much of a response, and then you're kind of back where you were with a little less money in the bank. So, but they don't endanger, they don't make anything worse, that you don't grow a tumor, there's no side effect, you don't bleed out from an ulcer because you took the wrong, all the side effects that we see with medicine and pharmacology, we don't see with stem cells. The downside would be, you're going to be eating, what should we say, TV dinners for a while or something, till you're back on your feet. All right, let's go to the next slide. So this is how. There's a couple ways. A lot of places that do MSCs use bone marrow. Here in this office, the technique that we do is a mini liposuction. We suck out about 60 cc's of fat. It's all under local anesthesia. You can see here on the, you can see here on the slide, we make a little incision right there, and we put anesthesia under the skin. I'm going to have you look here while I do it so that people online can see. We put anesthesia under the skin, and then just with normal syringes and the suction of a 60cc syringe, we move a catheter back and forth and suck out fat. It takes us about an hour to get enough. And we then send that fat to a stem cell laboratory, FDA-approved laboratory in Florida. And about 2 to 3 months later, they culture out the stem cells. And then we can order individual vials. And from a 60cc sample of fat, which is basically like 2 ounces, right? We can get somewhere between 15 to 20 vials of stem cells. Each vial has 10 million MSCs. It's a very high number. Normally, when we do an infusion here for autoimmunity, we'll do 20 million at a time. And we may need to repeat that every 3 months for the first year. So that's the process. There is another small segment of the operation that, depending on, it's coming actually to court, to the FDA, is actually in a legal battle with the stem cell company we use to fight this out in arbitration regarding in a couple weeks. It's going to be sort of a landmark case on where the regulatory issues go. But if we get enough extra fat, we not only send it to Florida to be cultured, but here in this office, we can spin down another 60 cc's enzymatically with minimal manipulation of that fat. We take away the enzymes, we wash the debris, and we spin it down, and we can get the stem cells and re-inject them into a joint or your body that day. So you don't need to send them off to be cultured. But if I only have enough, if I don't get enough to do both, I always send it to be cultured, because then if your knee goes bad, we just order another vial in 5 years. And then when we need them, you may miss the same day stem cell injection, but in 3 months, we'll be able to do it. So it can be a slow process, but that's kind of how it works. The other way is bone marrow, which we don't do, but it's the same process, that you can send the bone marrow, you can spin it down and re-inject the cells that way. That's one process. There are over-the-counter products that you can order as well. They are made from healthy baby deliveries. None of this is embryonic, so they're all healthy deliveries. Umbilical cord, placenta, or amniotic fluid. From those tissues, they can't manipulate it much, but they gather those healthy tissues, they screen for diseases, and they can process little vials. And what it really is some stem cells, but mostly it's the secretome. It's the growth factors and the proteins and the cytokines that those stem cells, which are very high in those umbilical and amniotic tissues, produce. And then you can inject those into a joint. And we see very good results with those too. Because remember, having live cells is nice, because they do live in the body for a certain period of time. In a joint, we don't know if they live a week or several weeks. But while they're living, they will continue to produce these trophic factors that stimulate those tissue-specific stem cells in the joint, cartilage, bone, to regrow. Whereas if you just give one sort of pre-made injection of the growth factors, it stays in there for a couple days and stimulates it, but you're not going to get the effect that live cells would have. Most of those over-the-counter products, I would say 2 cc's of a product that we would put in a joint may have 1 million stem cells, versus, when we get them from the lab, we'll put in a moderate joint 5 million, in a really bad, severe joint, we'll put in 10 million. So you can see it's not as many stem cells, but remember, it's not the stem cell that's differentiating into healthy bone. The growth factors are going to do the job too. And we learned this by a very interesting experience in, I think it was rat or mouse. They transected the spinal cord. They took the tube where the stem cells were growing, and they injected the stem cells into the gap between where they severed the spinal cord, and it regrew, right? Then they took the juice, the secretome, the secretions of those stem cells, and did the same thing on another set, and it got the exact same result. So that's where we learn these stem cells are probably not differentiating into new tissue. They're just stimulating that universal stem cell niche. So this procedure takes us an hour to an hour and a half. If we get enough fat, we send you out to get lunch. We bring you back an hour later, and then we'll do the injection of what we call SVF, stromal vascular fraction, which has about 2 million stem cells in it. And then we'll wait for the repeat injection when the culture's done. All right, let's see. Let me show you about the safety profile. I'm going to try and play this and see if we can get this woman you're going to see that shows up here in a minute. She's right here. This is Kristen Kamela. She is the Chief Science Officer at Your Stem Cell. She's the one fighting with the FDA right now. So she's the Chief Science Officer at Your Stem Cell. And she was being interviewed. I'm going to show you 2 clips of hers, one how she got into it, and one a little bit about the safety profile. So bear with me if there's any technical.
Going to be some first, effects. Has anything like this happened to you?
Oh, definitely. I mean, anytime you're involved in medicine, there are adverse events. We have had situations with patients, for example, in an eye indication, and we had adverse events. We decided not to move forward with some of those treatments while that is researched and studied. However, with our other indications, IV treatments, intrathecal joint injections, back treatments, it's a very strong safety profile. We have not had any major severe adverse events associated with it. Anytime you pierce the skin, there's a risk associated with that. You have a risk for infection. We've had some patients that didn't follow instructions and got a skin infection at the site. It's easily addressed with topical antibiotics or even oral antibiotics. We've had patients report a headache or slight elevated temperature, and all of these things resolve within 24 to 72 hours. So the reported side effects are very few and very manageable.
So relatively safe.
Absolutely. I mean, we've had less than 1% reported adverse events. When you think about it, aspirin has killed more people this morning.
Wow, I never really thought about it that way.
That's interesting, huh? Let's move on. I'm gonna let you listen to how Dr. Kamela first got interested in studying stem cells. So I'll play this for you.
Think about it, aspirin has killed more people this morning.
Wow, I never really thought about it that way. That's really interesting. So what made you want to go into this?
I studied engineering, chemical and biomedical engineering in graduate school. I worked on a technique called magnetic cell sorting. This is where we can tag cells with little nanoparticle magnets and separate them based on the proteins that they expressed. And one of the cells that we focused on was a cell that expressed a protein called CD34. This was a very interesting cell because it expresses a protein that is thought to be very angiogenic in nature, which means that it can help to form new blood supply, new blood vessels in your body. And this is in fact expressed on the cells that are of interest coming from the fat tissue. So I became very interested in how we could use these cells and apply them to different indications. So it was about in the year 2000, I was working with a startup company, and we were focused on using the cells at that point from bone marrow. This was before we knew we could get much higher cells from fat tissue in a knee joint to help regenerate meniscal tissue, damaged meniscus. And we were doing some animal studies with goats. And what we found when we looked at the goat knee joint is that, and we were blinded, we didn't know which ones we had injected versus not. And what we found is that the ones that had received the injections had very clear new tissue formation. And I actually got tears to my eyes, and I thought, oh my God, this is going to change medicine as we know it. This is a big deal This is, the equivalent of the Wright brothers' first flight. And if you remember from the reports, the Wright brothers' first flight, there was barely any media attention. Nobody realized the gravity of it. And I think that we're just getting to the point where people are realizing the gravity of cellular medicine and how we are going to change medicine as we know it. And we no longer have to just address symptoms. We can actually change the underlying disease.
Which is,
So pretty remarkable, huh?
Think about it. Ask for it.
Yeah, I think it's just, we're at the cusp of something amazing, and where it's going to go, it's going to take a long time to work it out. I can tell you just from trying to figure out what to use in the practice, and I'm still sorting through, there's so much conflicting data. There are so many shady operations out there. Anytime, it's life. I guess that's the world. People will, try and jump on it and take advantage of people and companies that you think, how could they not be honest? I mean, there's a lot of potential. So I'm not anti-FDA on this. I mean, we need to get the regulation right. We need to figure it out. We need help to sort through it. But my hope is that, the influence of pharma, the influence of the illness industry doesn't so stifle the development that, it has to be done delicately, like any new change into an existing system. But clearly, we're getting really good results here. I've done probably about 14 patients. We've done 3 joints, of which we've had good success. We did a hip that prevented the guy from needing surgery. We did a knee that took the pain away. She still has a little clicking, but it's much better. We did a 3rd knee today. And then we've done rheumatoid, where she's off half her medicines. We've got diabetics because, inflammation, insulin resistance, and type 2 diabetes is often a result of too much inflammation. So you've got these anti-inflammatory cells here that modulate the immune system, reduce inflammation, and suddenly their body's more responsive. We probably see more insulin production. Beta cells in the pancreas can now produce more insulin. So we see some really good results. The data on diabetes is even 1 injection can, for some people, it all depends on the numbers. So again, we usually have to do 3 or 4 injections here to get the numbers that the research is doing in Panama with Dr. Reardon. They'll give 120 million stem cells over 4 days. They'll give 30 million stem cells 4 days in a row, but you got to fly down there. You got to stay for, a week or 2. You got to, stay in a hotel. You got to meet their criteria, and it's 27 grand for those injections. What we do here is, I'll give you our pricing now just so you have an idea of the comparison. We're $6,400 for the liposuction operation and the same day SVF if we get enough fat, the same day stem cell injection. Then you pay another $3,000 to US Stem Cell for them to culture and cultivate the stem cells and keep them on dry ice. And then you pay them basically $250 a year to hold them in storage for you. Whenever you need them at that point, the cost of a vial of 10 million stem cells at this point is $500. We charge about $1,250 to process it when it gets here, inject it back in because we run some nutrient IVs before we re-inject them. So let's say you get 2 vials, you're looking at $1,000 to US Stem Cell for 20 million stem cells, and then another $1,250 for our processing here and putting them in. If we do a joint, it's like 500 more because we have to sometimes we get other, what's called PRP, platelet-rich plasma, to put in with the stem cells. But you can see, even if you did 20 million stem cells 6 times, you're in way under, and nobody knows if the 120 is the magic number, or is it just sort of a little extra every few months to keep the growth going? So all these things we don't know yet. We haven't worked out. Why do they give 120 million in Panama? Because they know they're not getting you back very often, and they want to get the results that they can get. People can't go back to Panama 4 times a year, but they can come across the street and come to our office. So, and then the nice thing is, if it's just a joint, anytime you need it, for $2,500 total. If your hip goes bad, your shoulder goes bad, your knee goes bad, and you don't want to go to surgery, we can order it up, and in 2 weeks, takes 2 weeks to get them cultured. So we send the fax to US Stem Cell, and 2 weeks later, we get the vials shipped overnight, and we get you in. And I don't do a lot of joint injections, so I have a physician's assistant who's very skilled in joint injections. We have an ultrasound machine now, so he just comes here and does the joint injections for our patients. So it gives you kind of an idea of the pricing. If you look at the over-the-counter product, so remember I told you there may be like 1 million stem cells in a vial of 2 cc's. Most of the time, you're looking at, it's much more expensive. So a single joint is going to be somewhere between 7,000 to 8,000 for one joint. And then if you need a booster down the road, it's going to be another probably 5,000 to 7,000, depending on what you do, or another joint goes bad. So you can see the benefits of having your stem cells cultured and available. You get one, and you can just, pop off a bad joint for $2,500 versus $8,000, and whenever you need it, you have more. Now the truth is that may change dramatically. One day, I think it will happen here when the FDA gets on board, or all the regulatory bodies figured out what happens in Panama, which is you can get high quality umbilical cord stem cells. There are some benefits to having what we call day zero, young, vibrant, robust stem cells. Just think of how babies heal, and think how we heal. So this brings us to another big unsolved dilemma in the world of stem cells: is how much is related to we don't have enough, and how much is related to the robustness. So we can develop a lot of tissue generation in a joint from just putting more numbers in there. But if you have umbilical baby stem cells, if you will, that reproduce every 24 hours and create a more robust secretome, maybe you only need 1 million compared to. So we don't know the answers to this. Nobody knows. We do think that when we inject them intravenously, MSCs probably, most of them go to the lungs first, and the lungs will sort of trap a good percentage of the 20 million stem cells that we put in, but that's fine because it's a very vascular area. These MSCs will live around the little capillary beds for usually, we think, somewhere between 4 to 8 months, and they'll continue to produce secretions that go into the bloodstream, out the heart, and everywhere your body needs it. So that's why most of the effects on joints, on autoimmune conditions, we tell people it's not immediate. There's an initial anti-inflammatory effect on a joint. You may have pain that goes away the next day. This rheumatoid patient I have that had bad neck pain along her nerve, and a pinched nerve, I just injected into the muscles along there. Literally the next day, she was pain-free. It came back a little. We did another injection 3 months later, and she has no pain in her neck anymore. But the point is, these stem cells live for somewhere, we say it takes 3 to 4 months to see the most benefit. And it's a process. The food you eat can help them work better or worse. High sulfur foods are very nurturing to stem cells. So things from the family like cauliflower, broccoli, Brussels sprouts, cabbage, arugula, all those cruciferous type vegetables, those are really good. Certain nutrients, if you're really depleted nutritionally, your stem cells aren't going to work as well. Even when we increase them in number and transplant them in. We're not going to overcome every problem, but you can see the potential. Let me see, I think we're close to, we've talked about this. These are the studies right now that Dr. Reardon's doing. Trials on multiple sclerosis, rheumatoid. This blew me away. You read the chapter in his book on autism. Now, here's where you can really, because I'm thinking to myself, you know, I have friends that have kids with autism, right? So this is not a disorder of us folks who are, you know, we've lived a lot of years and we want to be healthy, but I mean, this affects the whole life of that child. And the results have been remarkable in autism because we think there is an inflammatory component in the brain. You give these stem cells, it re-regulates that, and they have seen down there with the higher dose stem cells, kids literally reintegrate into a normal life. So it's just the possibilities are truly remarkable when you think like that. Spinal cord injury, of course, is giant. I told you about the study in the rodents, and we're going to see more and more. They actually have a guy in Panama. They probably have more now, but he talks about him in the book, who can walk again. Literally had severed his spinal cord, couldn't walk. They got to him, I think they didn't get to him until a year down the road, maybe 8 months. It doesn't have to be immediate. The sooner the better. But the treatments, we're going to see amazing results in that area in the future. Obviously, osteoarthritis, asthma, frailty. Asthma is great because remember I told you most of the cells go initially to the lungs, and they secrete their major secretions there because it's so vascular. When you put it in the blood, they go to the, you know, up the vena cava to the right side of the heart, and then out to the pulmonary vessels into the lungs, and they love the blood vessels. So, and there's inflammation there, and they get trapped. So people with COPD can reduce and often get off oxygen. I mean, really good results in COPD, emphysema, asthma patients. Athletic injuries. Oh, injuries are a no-brainer. I'm going to show you a picture here of my friend's son. Here's that limb study. Remember I told you about the 16 patients with all set for amputation, diabetics, right? Major limb amputation. Try and look here if you can and see where, because I want the people online to see it. My pointer's not crossing over. 12 patients healed. There were no deaths. 25% did have to progress to amputation. But I would take my chances, right? I'm going to show you the pictures of what happened here. This will be remarkable. Here's the sore. You can see here the ulcer on the foot right there, right? So those things they fester, they don't heal. Diabetics don't have good blood supply. The nerve endings aren't strong, so they don't even know they cut themselves. They don't even know there's infection, and before you know it, it's in the bone, and if you don't take the limb, you lose the person because the infection goes systemic and you get septic and pass. So there's a lot of things here, and this is kind of gruesome, but let me show you. This is the initial wound. This is different than the one that I just showed you, but look at that wound, how gaping. That's not going to heal on its own. Here's 10 days after stem cells. It's hard to see. Here's 10 days after, but it's starting to fill in. It's a little shallower. The edges aren't as deep, so you're starting to get what we call granulation tissue in here. And here's 14 days after, a little more healing. Look at this, 30 days. Look at the amount of healing that's gone on at the 30-day mark here. And now look at this slide. It just blow your mind. 60 days. From this to this in 60 days with a simple injection. No surgery, no recovery, no operative complications, no anesthetic complications, and they walk and they live and so All right, so let me talk about athletic injuries. Oh, and this is even more remarkable. It's hard to see here, but if you look here, this side is the blood vessels before the stem cells. You can see it looks like a little country road with a couple of small, driveways off of it. Look at this, it's like a major city now. These blood vessels from the stem cells have created what we talked about, all those angiogenic factors, and now the blood alone, even if stem cells didn't stimulate regeneration of existing tissue, if they just brought more blood supply to it, things would heal better. So you can see how remarkable that new blood vessel formation is. Nerves are a little trickier. We think a lot of nerve damage is from the lack of blood supply to the nerve. So if that's the case, then the nerve can heal. Nerves are probably harder than most things, just like spinal cord's harder than most. And I think what we're going to end up seeing on most of those nerve things, the future is that this is where the tissue engineering crew will come in. MSCs aren't going to be enough intravenously. They'll generate a tissue-specific nerve cell that they can then inject in multiple numbers into those areas to get them to work. So the future is going to be a combination of the MSCs, the medicinal signaling cells, stimulate the tissue-specific, and tissue engineering to create more tissue-specific types. I think the biggest place we see it now is going to be transplants. That's a no-brainer. With 3D printing and matrices that you can put these stem cells on and recreate, it's not going to be science fiction. I mean, you're not going to have to wait for a new cornea or a new kidney or whatever. We're going to be able to regenerate that at some point. In our lifetime, I don't know, but sometime in our children's lifetime, I would say. So here's this picture comes from a place called Surgeon X that sells that amniotic pre-prepared fluid, right? I told you about. So you can see the before. What you see in the before is it's kind of like bone on bone. You see it's bone rubbing against bone here. There's a little bit of cartilage here in that dark area. That is the space, so it's like a shock absorber. So you're not seeing the bone hit against another bone. It's hitting against a little cushiony pillow. And then you can see after the injection, look how much that joint space opened up. So that means new cartilage growth had to occur. Again, this was an amniotic product that has the trophic factors that stimulate tissue-specific cartilage cells and bone cells to regenerate, repair. This is my friend here next. This is Dr. Tony Gannum's a good buddy of mine who is a chiropractor. His son had this injury here, and this is a fracture, a little chip fracture off the elbow, the ulna, right? He was a pitcher in whatever little league, and he had to stop. He was out. He did everything, the orthopod, the rest, the splint, everything. Nobody could help him. I think it went on for close to a year. And then finally, Dr. Tony just said, hey, I've read too much about stem cells. He flew his kid to Florida. They put him under anesthesia. They did a bone marrow. They injected the bone marrow aspirate. They like processed it like we do with the fat for stem cells. And 4 months later, the kid's pitching again. The bone, the chip completely healed up. Everything's repaired. That's a growth plate, but this whole area is healed now. And so these are athletic injuries. There's no doubt about it. Strokes, heart attacks. If we can get stem cells into the brain at the time of the stroke, you can preserve so much tissue. The damage just doesn't happen as much. So that's the future where we're going to see it. Let me see, we're almost done here. I'm going to just, okay, I'm just going to briefly tell you, we'll send out a flyer on this, but I shared with you guys here, but not the online audience. We have a very generous donor in the family who knows about what I do with stem cells, and his family said, hey, we want to help. We have a foundation for vets. we want to help vets that have TBI, traumatic brain injury. As you know, when you get whether it's a blast from an IED, an explosive device, or just head trauma from banging up against something, or an accident, or a helicopter crash, or whatever these vets do for us, these military do for us to protect us, they end up with changes in the brain, just like the football players do, that lead to chronic, severe defects in cognitive function, hormone disruptions from pituitary hormones, depression, suicide. I mean, PTSD, all these things can come from TBI, traumatic brain injury. So their mission became my mission. So what we already did our first vet, I'm going to introduce you to in a second here, but the program will be, we want patients only from the practice, because we want to help our own first, put the mask on yourself first and then get it on your friend or whatever. And we want you to nominate anyone you know, current or prior military, who suffers from traumatic brain injury, and we will pay for the stem cells for a year. We're going to take the people. I will choose, from a medical standpoint, we'll interview them, we'll figure out who will best respond. From that group that we end up with, we'll choose a nominee that will be elected to do it. And the foundation, who they want to remain anonymous, otherwise I would shout their name to you because I'm very proud to be affiliated with them. But they cover all the hard costs. I donate my time, and we donate our time and materials here, and we want to help and we want to give back. So this is a really great program. So if you know anybody, if you have anyone in mind, or you yourself were in the military and you're suffering from something, you may qualify, okay? Okay, I explained all that. Okay, so let me tell you who's here. This is our first vet. Right here is Scott. This is him about 25 years ago when he went to boot camp with my son Chris in the Marines. So Scott used to come to my house because our house was, because the guys were either Pendleton or 29 Palms for most of their training. We would go pick them up every weekend, and Chris would bring back a bunch of the guys, his buddies, and they'd stay at the house, right, for the weekend. So they had some home-cooked food and a place to stay, and so we got to know a lot of the kids. So anyway, Scott's story will be online, but needless to say, he suffered some of his injuries during the military, but some afterwards. And he did get traumatic brain injury, also had a horrific episode where he was getting epidural shots for pain in his neck. And he had a really fluke accident about 8 months ago that paralyzed him. And it bled into his spinal cord. He just went for a normal, epidural, injection of steroid to take the pain away. And the pain was he was swelling, he was having a bad headache, and he said, "Is this normal?" And he had done it multiple times before. And the guy said, "Yeah, it can be." Well, clearly it wasn't, because it kept getting worse and worse. Anyway, they needed to do major surgery on Scott, and you can see here, they cut him open from here to here. It took, I don't know how many hours to vacuum out the blood, but it left him paralyzed. I think he could move a little in the one. Well, they basically said, "Hey, it's unlikely you're going to walk again." But Scott's a Marine, and he's a fighter, and he wears a shirt that says "Crush Everything." That's it right there. And Scott crushed it. And I don't remember the exact details. It'll be online on an interview that you can watch on YouTube. But within a couple weeks, he was walking again. Now he walks with a limp. He needs a little walker now. But we did the stem cell extraction on him 3 months ago, and that we were able to get enough fat to do an injection that day of the SVF. And then he came today. He flew in from Arizona this morning, and left this afternoon, and got his first 20 million stem cells IV. On Scott, I did a special, also another special procedure. We gave him what's called IV mannitol. It's a special solution that helps open up the blood-brain barrier so the stem cells can get into the spinal cord better. Because the only other way is to do what we call an intrathecal or go into the spinal column. I'm not trained to do that. I mean, I did it as a resident, but I haven't done it in 30 years, and I'm not really qualified to do it. And it's a little risky because he had this prior bleed, so I don't want to mess with that. So we may do some down the nasal thing if I can figure out how to do that and learn that technique. But anyway, this is Scott, and he came with his wife Maria, his little daughter Isabella, has 3 other daughters at home. He goes, I do this for my girls. I can't, I'm not giving up. I'm not giving up. And so this was when we did the little mini liposuction on him. That was November 15th. It's a little scary. I'll show you the size of the needle there. You can check it out. That puppy's, yeah, that's a little too TMI, too much information on TBI. Oh, no problem. You didn't like that. Well, all we do with that is we put the anesthetic under the skin, under the layer of the belly. We're just under the skin. We're in the fat, and then we put suction things into the fat. But I wanted to show you that because I thought it's cool. Okay, it's showing again. Let's move on. And then this is where we, and then for all we do here, this is how we put the SVF in. Oh my God. So the start IV, fantastic. So we got make sure we have good IV access. Pull back on it. So just this, we're gonna get the steam smell. That's the SPF. It has a sort of pink, reddish tinge to it. Last thing I'm gonna do is give you an air embolus. And then all we do is we hook that up to the IV, inject them in. Perfect. It's not really, it doesn't go as units for this. It's just it's from that 60 cc's of fat. We got the final stem cell pellet. This usually will have about 2 million MSCs stem cells in them. So we're gonna just push these in. Just imagine them going to the area you want them. Because that's what they do. They hone in on the inflammation. They'll dock near a blood vessel and they'll stimulate the tissue-specific stem cells to do their thing. So wish them into the way. Wish them, yeah, just wish them in. So that's all we do there, and then we follow it with a little saline injection. Normally, most people think nobody knows exactly, but most people think they live about 4 to 8 months before the immune system, sort of discovers them and picks them up and clears them out. But during that time, they will continue to produce growth factors and cytokines and, stimulate healthy tissue response from your tissue-specific stem cells. You're just flushing the saline to get all, I want every single thing. Mostly they go to the lungs first and they kind of hang out there for a while, produce growth factors, and then they'll travel through the body, and the growth factors they produce will go through as well. Yeah. And that's, in terms of so what we end up with is a little pellet. Shannon's the one that does the processing. When we do it together every time, you end up with a little pellet that's probably like teeny at the bottom of the test tube, and then we'll add like 5 cc's of saline to dilute it out. But they actually, because you spin them in a high-speed centrifuge, so you're looking at a pellet maybe the size of a frozen pea. Is it that small? And then we mix saline in and we, shake it up so it's suspended in and then we push it in. And here's Scott. You can see what he said. Scott on the sled. Did it again today. You should see all these healthy people at the gym that watch this crazy guy on the walker set this up and then push it. It takes about 20 minutes to set up and take down for 10 minutes of pushing. For me, though, it's the mental aspect. I can probably do other exercises for my legs that are better, but the Marine in me needs to push this sled and feel the pain. So I think this is there you go. That's about 3 weeks ago for a guy who was supposed to be paralyzed. Now that's not from our stem cells. That's from his conviction. I'm hoping that our stem cells gets him to continue to heal, but I will not take credit for that. And anyway, that's it for the formal presentation. Any questions? Yes, Madeline.
What about those of us that wouldn't find the liposuction and we have extra
Well, okay, I would love to, but that's really going to end me up in problems because the only thing we can do is what we call autologous. So the fat that comes from you has to go back in you, minimally processed. Now the truth is that from Panama, we know that these stem cells, the MSCs, are immune privileged. We could take your stem cells, put them in Larry, we could take Larry's, put them in Suzette, Nathan, Pat, and they will work perfect. There's no rejection. They are immune privileged. In fact, they're using stem cells now as part of organ transplants to prevent the rejection.
What about in the stockpile? I mean, they do it now for the problem later.
And that's what we're talking about. That's what we can do with, yes, and that's what we do in.
There's a 3-month lag, if you have an injury, it might be.
And that's why I like the liposuction procedure, because then you've got the cells at the bank and you took the time now, because the truth is your stem cells will never be better than they are today, because we can't go back in time. But today they're going to be better than they are in a year, and they're going to be better than they are 5 years from now. So yes, you can stock your own stem cells. They store them at US Stem Cell, and we do the procedure, get the fat, and then put them in. But again, the future will be, yes, we'll take healthy baby deliveries. It'll be just like Panama. There'll be day 0, robust. See, because a stem cell from a newborn divides about every 24 hours. The stem cell from someone who's 60 divides about every 60 hours. So it takes a lot longer for them to, and they don't have quite as many divisions left in them. Now we can culture them out because we get enough fat to make up for it in numbers. And like I say, it'll work in many things. But I think if you just imagine the future, it's going to be day 0, umbilical cord. What are they doing with umbilical cords now? They throw them away. Well, I will tell you that our rheumatoid arthritis patient that we did it on, we couldn't, she's a bodybuilder. She has about less than 10% body fat. The day when I decided that we were going to do her, I called US Stem Cell and had them send the trainer up, and I paid for that person to come and spend the day with me here, because I looked at her and I'm like, there's nothing. So we ended up going in her butt. We were able to get it from her butt. Sometimes we can get it from thighs. We only got 30 cc's from her, but it was enough to send off. It was, I know, imagine that. You think if I only have 30 cc's of that, who needs a stem cell, right? I'm just where I want to be. No, you medically you could, but they would come and take me away to the wherever they lock up bad doctors. So no, we don't do that here. But it can be done, and eventually it will be done. So that the answer is yeah.
Is it recognized by insurance yet?
No, it's not. But I'll tell you that I don't think that'll be as long as you think, because when you look at the surgery and you look at, let's just take a total knee or a hip, that's got to be total cost between the doctor and anesthesia. There's got to be 50 grand, right? And then that's not even counting the downtime. I don't know. Did you get your bill? What? 60 grand. Madeline just had a total hip. 60 grand, and that's not the downtime and the help you need, and that's just all those costs. So why will a third-party payer not say, you know what? We're not going to do surgery on anyone until they've had 2 stem cell injections 3 to 6 months apart. So when the financial benefit shifts in their favor and the FDA guidance is clear, I think we're going to see that'll be the first step. Joints will definitely be the first step. So yeah, it's going to happen. It's inevitable. It'll happen. And it has to happen because it can revolutionize a lot of the healthcare crisis. You still have to have a healthy lifestyle. You can't eat McDonald's every day and do this stuff, and it just eventually you just destroy too much of your body, you know. Yeah, it makes it more difficult for them to be healthy, you to be healthy. But anyway, thank you. And any online questions? Nobody figured in. Okay. Well, thank you very much, everybody. It's great to have everybody back in the. Thank you.
Yeah, good luck on your TikTok. You ought to do great.
Oh yes, I was invited. I haven't been chosen yet. Not a full TED, but a TEDx. One of my patients who we've done stem cells art lives in Oregon, and she's organizing an event up near Ashland. So she's invited me to give a talk because she knows what I do. And so I've applied, and I'll let you, if I do get selected as one of the 10 speakers, we'll post it. We'll send you a thing. But
Is there any advantage to not wait for like your hips back, to just do that regularly? Does that keep you healthy? Does that
well,
start the aging process?
sure. I mean, nobody's going to say do it if you feel perfectly fine. But if you have, you feel it's starting to ache, the earlier you do it, the better result you get for less stem cells. There's no doubt about it. If we would catch this stuff at very early grades, like you don't wait till a grade 3 or 4 out of 4, but you hit it at a 2 where there's a little bit of joint space narrowing, you get a little bit of achiness and pain, you do it then, that over-the-counter product stuff will work great. It'll probably help a ton. But if the longer you wait, the more regeneration you need. So yeah, I think people will do it at earlier stages, but it'll probably at that point be elective. Insurance will probably cover when it's surgery or maybe this will help. If you want to do it, it's just like everything. If you want to optimize your health or wellness, insurance isn't. It's like your home insurance isn't going to, pay for you to change a light bulb. They'll cover the big damage. You got to hit that $1,000 deductible, and then they'll chip in if you fight with them enough. So yes, and by the way, this is one of the reasons I did get into it. Dr. Kamala, you didn't hear, but on other parts of that interview that she did, she predicted, and she has so much more experience on what happens to people. She predicted it will be a wellness event. She said, there's no doubt in my mind that people will come in as they age, whatever it is, wherever you call aging happening, let's say 50 and above, and once a year, we'll just give them an IV stem cell injection and just let it go wherever your body needs it most. They know where to go. They're healing system cells. I didn't give this my favorite quote from Bernie Siegel, who was a Yale author and surgeon, but he said, hey, as a surgeon, I cut into the wound and I rely on it to heal. I don't need to yell into it and tell it how. We don't need to tell these stem cells where to go, what to do. There's an innate intelligence in the body. You just need to give it to them and have the chance for them to heal. So yes, it will absolutely, I think, be part of a regular wellness exam, or treatment to stay healthy, stay well, and for sure joints people will do earlier. Yeah. I mean, you can only imagine it's going to cosmetic stuff is going on now. Now, there's been some catastrophes with stem cells and cosmetics, like somebody used, I think, the wrong kind of stem cells. They did a filler thing, and the stem cells turned to bone, and they had bone slivers, and they had to. So you got to be sure you're using I don't know if that was out of this country or where, but it's got to be reputable, pure, really regulated, good stuff, good stem cells. But they're using them in because you put them with fat, you put stem cells in there, and these things of aging, we want to go like this, you know, they really disappear. And the effect isn't like 3 months like a Botox or, 2 years like a Juvederm or whatever they're using. It could be 5, 10 years that it just fills, and those cells keep it alive because it's filler, So yeah, it'll be used a lot in cosmetic, which of course won't be covered. All right. Well, thank you very much, everybody. Thank you. Grab some refreshments on your way out. And thank you, everybody online, if you're still there. I don't know if you didn't. Okay. I'll say thank you, everybody online. I hope you enjoyed that. You'll get an email, by the way, with the replay. If you want to listen to any of this, you'll get an email. If you would sign, if you didn't sign up, I'll send an email that'll show where you can give it to your friends and they can watch this because it recorded. Bye-bye.
In college, and she keeps having to have it operated on, and I'm wondering,
Who's this?
my daughter.
Oh, your daughter-in-law?
She's like torn her, from being a.
Right.
gymnast.
Yes, wear and tear. And...
It's still a problem, and she has to have things done to rehab.
Yeah. Yeah, this is the kind of thing that could make a major difference for sure. And by the way, I didn't talk about it, but that the other area where we're going to see it is literally on football fields. If there's a head trauma, if a guy gets a concussion, they'll just hook up an IV right there. If you give the injection of stem cells right at the time of the trauma, you can prevent the traumatic brain injury. Yeah. Yeah, the autoimmune to me is why I got into it, because so many of my patients have autoimmune problems, and some can heal it with diet and supplements and really big lifestyle changes, but it's rough. This, if you add those things that we taught you years ago in functional medicine, the detoxification, the right supplements with stem cells, that is going to be revolutionary for autoimmune diseases. I don't think there's any question about that.
What about, like, the spinal, you have this collapsed or?
Oh, vertebrae? Yeah. Well, a lot of the people there are, and this is where tissue specifics, they are working on tissue specific stem cells for those kind of things where they can inject them right into those areas. Spine's hard because the blood supply is very poor for a reason around the spine, surrounded by cerebrospinal fluid, but not a lot of blood vessels. And remember, these MSCs that stimulate regeneration have to follow blood vessels. So that's why spinal cord injuries, you almost have to get into that spinal fluid, open up the blood-brain barrier, or go intrathecal, or a direct injection like they do epidurals now, but into. It's a little riskier because that's how Scott bled, from a regular epidural. But yeah, that'll be the future too.
Thank you.
You are welcome. Thank you. Thanks, guys. Nathan, good to see you. Great to see you guys. Larry, take care. Yes, I did. And are you set to discuss them? Next week? All right. All right. We'll go over them. Oh, and the